Thank you all for attending today's webinar. This is the first webinar in our 8-part series, Home Matters, Rethinking Aged Care Design, that we're running with Dementia Training Australia. I'm Genevieve Donnelly, and I'm the Assistant Secretary for Dementia, Diversity and Design Branch in the Department of Health, Disability and Ageing. I'll begin today by acknowledging the traditional custodians of the lands on which we are all virtually meeting on. I'm based in Canberra on the lands of the Ngunnawal people. I acknowledge and pay respect to their continuing culture and contributions that they make to the life of this city and this region. I also extend that acknowledgement and respect to other families with a connection to this region and any other Aboriginal and Torres Strait Islander people who are in the call with us today. There will be a Q&A session at the end of this webinar. Please submit questions in the Q&A function. You may need to click on the Q&A icon at the top of your screen to activate the function before submitting any questions. You can upvote questions that other participants post, and this will help guide which ones are directed to the panelists when we get to that part of the session. There is a difference between liking and upvoting functions. Liking a question won't change its position on the screen. Upvoting it will push it up the list of questions that we see. We will attempt to respond to as many questions as possible. Questions and answers, including ones that we may not get to today, will be published on the frequently asked document on our website. Questions submitted during the registration process may also have been considered for today's session. We sometimes receive questions, though, that are unclear or not directly relevant to the webinar. During this session, we'll only be responding to the questions relevant to today's topic. Other questions will be directed to the relevant areas of the department and addressed through the frequently asked questions document. There is no option for attendees to turn on their videos or microphones today. Webinar slides are now available on our website, and this session is being recorded and will be published on our website in the coming days. Today's webinar aims to support older people, their families and carers to understand how good design improves quality of life for people living in residential aged care communities. We'll hear about what to look for when choosing a home and what helps older people living in residential aged care communities to maintain their independence and wellbeing. I'd like to thank the panel for their time in joining us today. Your generosity in sharing your expertise, insights and lived experiences brings real meaning to this conversation. Today's session is about empowering older people, including people living with dementia, to share their experiences and understanding of good design. The voices of older people are at the centre of this conversation. Good design and good care start by listening to what matters to people in their everyday lives, understanding and respecting their preferences, experiences and identities, and responding to them in meaningful ways. I will now pass on to Isabel Meyer from Dementia Training Australia to host today's session and introduce our speakers. Thank you.
Thanks very much, Genevieve. It's wonderful to be here today. Welcome everyone, and thank you for joining us. I hope you find our conversation today gives you some ideas and some inspiration on this really important issue. I'm going to start by introducing you to our speakers for today's session. And I'm going to start with the wonderful Gwenda Darling, who's an aged care activist. Gwenda was diagnosed with younger onset frontotemporal dementia about 14 years ago, and acknowledges that medical and allied health services have really assisted her in her quality of life. Despite the changes in her brain, she believes in the power to build new neural pathways and focuses on openly sharing her experiences to support others. Her advocacy promotes acceptance and assists with the development of resources that help people with dementia and their carers to live well at home and in other settings. Gwenda has recently made the decision herself to move to independent living as part of a residential aged care community to continue her life adventure and to ensure her quality of life is maintained. Gwenda serves on OPAN's National Older Persons Reference Group, the Aged Care Quality and Safety Consumer Advisory Group, and the National Ageing Research Institute's Community Advisory Panel. And through these roles, she informs research and policy while living independently with the support of her assistance dog, the marvellous Miss Redley. Our other panellists today are Marie Alford, who's the General Manager of Growth and Innovation at Hammond Care. Marie is the General Manager of Growth and Innovation, where she leads work focused on reimagining aged care and dementia support. She's known for her courage in challenging the status quo, centering living experience, equity and human rights in everything that she does. And with decades of experience across aged care, policy and cultural change, Marie's leadership is grounded in relationship-centred practice and practical disruption that goes beyond innovation for innovation's sake. And our last panellist today is Nick Seaman, an architect and environment specialist with Dementia Training Australia and co-author of the National Aged Care Design Principles and Guidelines. Nick's specialty is in design to support ageing and dementia. And as an environment specialist with Dementia Training Australia, he leads national initiatives to develop and implement workforce training to help create more supportive environments in residential aged care communities. And as an architect, Nick oversees a firm that is focused on aged care, remote Aboriginal health and social services. He's a lead author of the National Aged Care Design Principles and Guidelines for the Department of Health, Disability and Ageing. And Nick is committed to improving the built environment in aged care and health services and works on projects that enhance care outcomes and workforce capabilities. So where we're going to start today is a conversation highlighting key issues and concerns that might occur when people are moving into residential aged care communities. And it's one of the reasons why actually this webinar series is so important. There will be opportunities in the conversation today, and I'm hoping they'll be reflected in your Q&A, to actually really dig a bit deep about why it is that people move into residential aged care communities and what the perceptions of some of those residential aged care communities might be and how they might have changed in recent times. So, Gwenda, I'd like to lead off by actually asking if you could tell us a little bit about your experience and the decision that you made to move into independent care, independent living in a residential community.
When it became obvious to me that despite their desire, my family didn't have capacity to care for me at home. And I knew this because as much as they would want to, I could be a bit difficult and they would burn out very quickly. So I made a decision, and I'd lived in fear. I'd lived in fear probably since my 50s of going to residential care. We have this dream of the fairy tale white wedding. We're going to have children who are doctors and solicitors and they're going to all live happily ever after. And then suddenly we move into our 50s or 60s and we fear residential aged care. And I decided to face it. And I went looking and I looked at over 100 residential aged care facilities and models. And there is no doubt in my mind that the small home model is the best model.
Yeah.
But they're very hard to find.
Yeah. I think we have a way to go in Australia, don't we, to have the kind of residential care communities that we'd all want to live in. And I know in my own family, when we were assisting some of our relatives recently to make this decision, we, like you, were on a journey to find the perfect fit, the perfect place. One of the things I'm wondering, though, is are there specific things that influenced your final choice that might be the principles that we would take forward when we're thinking about, well, if they're not all perfect, how can we make them better? Were there things that you were looking for in particular?
I looked from Tasmania to the top end. I wanted someone with independent living attached to a residential aged care facility with more than one level. And so I could build a community who knew who I was and I knew who they were as I kept going on my adventure.
Yeah.
And that was what I chose, was where can I still live a free life, be part of that community. And I had a middle of the night episode actually this week, Sunday night. I woke up and suddenly there was a band dressing on my arm. The RNs had come down, the ENs, they'd done the dressing. I have no recollection of any of it, but it proved that I'm in the right spot.
Yeah.
Because when we need those things, we need them. Family could have done it.
Yeah.
But they wouldn't have been happy about getting up in the middle of the night. I think what made my decision was purely on the lived environment, as in the independent living, and I was quite happy to go back to an area where I previously lived.
Yeah.
Because I moved 9 hours away to go there, but I
Yeah.
had lived there prior, and I think it's really important that you have some community connections wherever you choose.
Yeah.
There are a lot of people in residential care who have been removed from their communities and know nobody in the outside world. It's still like an inside and an outside world.
Yeah. Yeah. And it makes it much harder, doesn't it? With my grandmother's experience, she found what for her was the perfect fit, but it was nearly 1,800 kilometres away from the tiny little remote town that she lived in for most of her adult life. And there was a long period of adjustment. And like you, she had reached a point where she knew that she needed support and care to wrap around her in her environment, but she wanted to continue to be really ferociously independent. But the journey to form new relationships in the facility was pretty challenging for her. I wanted to ask you what you think it means to have a really great team of staff who can assist you to settle into a new environment, and to also ask about their responsiveness when you maybe wanted to make a few changes here and there in your environment.
Look, I'm not going to pretend it wasn't. The first week and 2 months were horrendous. I was lost, and it happened to be coming into the Christmas period, so there was nothing happening. And so that was a really tough time. But the day I moved in, the CEO and the manager came with a box of roses chocolates. They'd already found out my favourite chocolates, and they bought me the box of roses. I think in the first week, I invited the CEO to morning tea, and I had my list for her. And she asked me the question is, what would I like to see that would make me feel better? And I said, someone to play Scrabble with. And that happened within a week. We now have a Scrabble club going. We play for sheep stations. And it's been so good for me and for the other residents as well. But it's finding that one little thing. It's like the fellow who makes birthday cards for everybody on his computer. He's 102 and he makes birthday cards. You've just got to find people's niche. Training the staff's still really hard. I haven't got all the staff trained yet. Some of them really think that they can just do what they like, and individuals have choice and staff have to honour that. And while they're very good there, I don't think they've quite learnt what the do not disturb signs on the doors mean. We've got to keep reminding staff of people's choices.
Yeah. One of the things that I know Marie and Nick are going to talk about today is this idea of privacy in spaces, but also spaces that are flexible enough to now allow for the sorts of activities that you've been talking about. How much do you think, Wenda, the actual physical environment that you're now in encourages you and your fellow residents to interact as a community? And how much maybe do you think it might get in the way a bit sometimes?
It's a really tricky question because I'm a little bit difficult. I'm not interested in playing bingo. I went once. I did give it a go. I went once and moved my milk bottle lid sort of thing, but I'm not interested in that, and nor are a lot of other residents.
Yeah.
And I think for me, it's about the connection, the relationships with people, finding out who they are. When staff tell me somebody's nonverbal or somebody's just left in a princess chair, basically, between morning tea and lunch, and I make it my business to go and meet that person. And there's nothing makes me happier than when somebody who's speech diverse actually uses their words. And I have to say, I've never been happier in my life, ever. And it's brought such joy to my life, those smiles when they pat readily, the word, it just brings so much joy. And I think there's so many of us out there who are trying to stay at home because we're so afraid of going into residential environment.
Yeah.
And it's not all bad. If I can get one message, it's not all bad. Find one for you.
Yeah. Do you think there's a bit of a stigma about residential aged care?
Oh, I definitely think there's a stigma because it's what they're nursing homes. You can't, you can't communicate, you can't do anything, you're trapped. In the community, there's a real stigma. But with dementia, especially, Isabel, I'm finding dementiaism is rife.
Yeah.
People with some cognitive decline don't want people with dementia near them. It's almost like it's catching. And I find that really interesting because I know the stigma, but I've never experienced that before. But the perceptions of the community, if I get in a taxi and say where I'm going, straight away the whole tone of the conversation changes, and because you're one of those poor old ladies in a nursing home.
Yeah. It's I think we're all on a bit of a journey to reform our ideas about what residential care communities could actually look like. I don't think that's limited just to aged care, though. I think a lot of the homes that I have visited in the disability space, we have similar challenges around what does a supportive environment look like for people, and how do we get better at the design elements that can really facilitate independent living and quality of life. Marie, I'm wondering if I can actually ask you to join us now and to talk a little bit more around the importance of flexible spaces and the elements of choice that are really important to assist people in making a good decision about the residential care community that they're going to want to live in, and how once they're in that community, they can actually be a force of change, as Gwenda's been, to make changes in not only the quality of their own lives, but the lives of their neighbours and residents in the facility itself.
Absolutely, Izzy. And I think that notion of choice is really important here. And Gwenda's talked to some of it around activities, but we make choices every day in the spaces that we live in. And so this morning, we all made choices when we got out of bed and walked to our wardrobes and picked out our outfits for the day as we walked the well-worn pathways to our kitchen, which we can do probably with the lights off early in the morning, to perhaps put the kettle on to make a coffee. Our spaces enable choice, and we need to make sure that when we're thinking of residential communities, be it at home or in those residential care communities, that we're really creating enabling spaces. And so that flexible footprint, and I know we're going to talk a lot more about that as we go through some of the areas within residential communities, but the ability to be flexible in the way we think and use the spaces in which we live. Communal living is really difficult. I'm not sure that anyone on this call would put their hand up and say, I'd love to live with 20, 30, 40, 50 other people. Sometimes it's difficult to live with our own families. We need our private spaces. And so flexible footprints that enable that, but they can also enable more engagement from workforce in those spaces. So flexible spaces enable individually tailored activities to occur and things like day-to-day cooking and cleaning, and just time to be by yourself or with others.
Yeah, I think you make a really good point about the space needing to be flexible so that it can adapt to meet the needs of the person and to enable the activities that are meaningful for them. But Gwenda raised a really important issue about privacy and the extent to which staff and others maybe have a flexible idea about what privacy means, and how do we work within the concept of communal living to establish those sorts of boundaries?
Dignity and risk. That's really what it comes down to. And sadly, we're a bit risk averse across the aged care sector. But, Gwenda is a great advocate for this notion of taking a risk and that dignity around individual choice and making those choices. And from research that's happened in the Dementia Support Australia program, which delivers the Australian government behaviour support programs, we know that those first 12 weeks when someone moves into a residential community are one of the highest risk moments for something to occur, an incident to occur. And that's because we're not prepping the space. We're not thinking about that move into that residential community and what might be important for the person that's living there. And that might be their preference to keep their bedroom door closed. But line of sight might require the door to be open so they know which bedroom is theirs as they meander down the corridor. And so we need to navigate these tensions. And that really goes to understanding individual needs and preferences of the people living in those communal spaces and creating great wayfinding moments for them to navigate those spaces as well.
And at a very practical level, it's, things like symbolic signs. It's also potentially introducing a buddy that could help you navigate spaces. It's about the staff all understanding the individual and their preference for Rose's chocolates versus Ferrero Rocher, to make sure that they are welcomed as well as accommodated. The wayfinding thing is a really interesting thing because I think we all get lost when we're in an unfamiliar environment, and getting lost is a stressful thing. And if you're somebody who has even a mild cognitive impairment, that level of stress as it escalates can lead to a lot of challenging interactions in that new space. Are there ways, do you think, we can do that better too?
Yeah, look, I think about from a staff perspective in any company, we have an onboarding process. It's 4 weeks, 6 weeks, 12 weeks, wherever you work. And during that time, as you say, you might allocate a buddy. There might be additional supports put in place to ensure you know where the lunchroom is and where the bathrooms are and where the photocopier is and how that works. In residential care, we don't always think about that. So in that onboarding process, we need to be thinking about how we support people to navigate those spaces. But using really familiar iconography in spaces can actually trigger those transition moments from private spaces to personal spaces. So excellent line of sight down corridors. And also thinking about sensory and tactile environments, being aware of lighting as a way to really help people ascertain, day from night. And so as the day changes, what mealtime it might be. And I know Nick's going to talk about one of my favourite topics, food, shortly. But these things are vitally important, and I think we can do better. Even simple things like a coat rack near a door leading to the outdoor area with coats on it, and maybe some gumboots or shoes, because lots of us change our shoes as we go outside. And so it's a trigger for someone to know when to go outside.
Yeah. And Nick, I'd really like to hear some of your views now about, what are some of the examples that where the role of the environment can actually be a really powerful enabler for people in terms of their engagement in the space and their engagement with others as well.
Thanks so much, Izzy. Marie and I put together six different examples, and I think this session's great in terms of when we think about what we're looking for in a residential community or what design features support people, these are questions that are at the heart of the principles and guidelines, and we'll keep coming back to through all of these webinars. And the big ideas we're talking about, like independence, home and choice, these are really like big issues in the context of people facing really hard challenges and burdens in terms of moving into residential communities. And for me, it's really important to go back to what Gwenda was saying of coming down to individual experiences, the relationships between residents and staff, and what Gwenda talked about of finding that one thing that rings somebody's bell, that one thing which is meaningful to them, whether it's Scrabble or being part of a community. What are the small routines and activities that give us meaning? So meals are a big issue for me, and I start by thinking through like examples of what I've seen when I've gone into various communities. And in one particular example, I just finished work on a project to make changes to a building to shift it to a smaller scale environment. And I walked in there at 11 o'clock, and there was a staff member making flapjacks for a resident. And for me, this was just wonderful because firstly, they're chatting away, it's normal, and it's at 11 o'clock. It's not at this designated time of 8:45 or 9 o'clock. It was all something which worked for him, and they're giggling away and chatting as they make this thing. So that was lovely. And for me, that issue of what we do with our meals, what we do with food is really important. But when we were preparing for this, Gwenda made the point that for each of us, this is a very different experience. So the image on the right is from from a residential community, and that might work for some people. But Gwenda's previously made the point that for many people, it might be that sitting in front of television having a meal is much more home for them. And so I think what I look for when I work into a residential community is I'm looking for a variety of things happening, for different experiences of a meal and people having that choice. And what the building can do is the building can provide somewhere that somebody can make a meal or make a snack or get some food. It can invite residents and their families to actually be involved in that. So it's not a locked door into a hidden kitchen, but it's somewhere that they're invited to actually store some food or make scones or whatever works for them. And it's going back to that issue of what Gwenda and Marie both talked about, of a lot of smaller scale spaces giving us the options to work out what we want to do and not be stuck with, in a room of 40 people, but being able to do things which work for us. Marie, have you got more that you want to say to this?
Yeah, I mean, I love food, let's be honest here. And today in my office, we've got teams from all around Australia visiting here on Ghana land in South Australia. And I could smell someone had bought some barbecue chicken and some hot chips for a communal lunch. There was some hot focaccia bread cooking in the oven. I could smell and hear what was going on while I sat at my desk. They're the triggers that we talk about. I love a fresh cooked kitchen in a residential community. It's not always possible. We understand that. I think this is not about saying knock down and rebuild everything. Retrofitting is possible, as well as creating elements of fresh cook. So those smells and aromas, the noises that you were talking about with the flapjacks, they're the things that draw people from their rooms. So it's a real opportunity to make a difference.
I have to say that my grandmother very proudly gave up cooking when she moved into her residential community, because she said, I have been doing this for someone every day since I was 14. It's my turn to sit at the table and have someone bring me the food. But what she did love to do every morning, well before anybody else was out of bed, was get up and make herself a cup of tea. Gwenda, I'm interested in your view. Does this idea of being able to access a kitchen and be responsible for your own food resonate with you and with some of your neighbours?
In the residential facility where I am, they all have a little sink, a little kitchen like a hotel, a little space for a bar fridge, even though it's residential type living down the corridors, but they do have the space for that. They can have a kettle and a toaster. Now, if I can't have an air fryer, I'm going to be pretty stuck. But you've got to consider what the individual wants. And no, I won't be able to have an air fryer in my room. That's realistic. But why can't they put one out in a common area? And like making flapjacks that Nick was talking about, why can't I do that? I think food preparation, one lovely lady from Ukraine keeps telling me, I just want real lettuce, not the white stuff.
Right.
And she has a fridge in her room and she keeps her own lettuce in it.
Yeah.
And so when salads are being served, she takes her own lettuce and puts, so she doesn't have to eat the white stuff. And I think that's where you come back to personal choice.
Yeah.
However, we also have to look, and I'm going to go here now, is the dollars. Because not everybody has the money after they pay their 85% or whatever to buy their own food on top of what they're paying. So I think that's something you really have to look at when you're exploring residential aged care communities. Does the food suit your palate?
Mm.
And I looked at one that the food definitely didn't suit my palate. There was too many spices, there was too many things. You've got to look at that as part of your consideration.
Yeah. Yeah, a really good point. But again, it goes back to this idea that what we should be doing with flexible space and good residential care communities is making sure that we're being as flexible and accommodating as much of the individual's needs as is practical and possible. Marie, I wanted to just explore a bit further the concepts of personal space and the sanctity of the bedroom and what it might mean. Now, Gwenda had raised at the beginning of our conversation today, people not understanding the do not disturb sign or what it meant to have a closed or a locked door. I'm wondering if I can ask you to reflect a little bit on, what a bedroom means in a residential community setting.
And I think to do that, we need to think about what our bedrooms mean to us currently. They are places where we not only sleep, but they're intimate spaces, they are quiet spaces, they are spaces that we might escape to away from children or partners or the busyness of the day. They're places where we might like to read a book or nap. So all of that changes when you go into a residential care community because the personal and private and public spaces need to interchange for a range of reasons. And we understand that clinical care needs support with day-to-day activities, but that sanctity of the space is really important because within communal living, there isn't always a lot of private spaces. And so the bedroom becomes one of those spaces that we need to really consider. And we need to think about things. I know when I look at housing, wardrobes are never big enough because I like choice in my clothes. I'm going to put it out there. Like Gwenda, I like a lot of shoes. You can see a residential care bedroom here in one of the images, and look, it's not a lot of wardrobe space, which limits the choice. And we want to ensure that people with dementia have good choices to make. But we also want to honour their agency and their autonomy and what they wear and how they dress. And so that's a really important aspect that I think sometimes we neglect. And we want to ensure that the furnishings and fittings in these spaces are familiar to people. And sometimes that's as simple as a bed lamp on the bedside table, because a lot of people have had that growing up their entire life. And I hear sometimes when I talk to aged care providers and designers, well, but they won't use it. There's great lighting in the room. They've got windows, overhead. They won't use the bed lamp. Okay, they may not use it, but again, it's a wayfinding. It says, this is my bed. This is my bedroom. This is where I might put the book that I'm reading or my glasses overnight. So familiar bedspreads that help us orientate as we come back from the public spaces. Oh, I can see that that's the quilt that I've always had. It's got my favourite patterns on it. Or here's my favourite chair in my bedroom with the throw rug thrown over it. So space for personalisation, for photos. And sadly, sometimes I hear when I talk to providers that they don't want too much clutter in there. And I get that there's a lot of navigation that needs to happen as care needs change. But we need to think about what makes people feel safe and secure. And sometimes that's our belongings being around us. And that might mean you need to be careful of other people intruding on that space. And some data from Dementia Support Australia indicates that the highest risk for a SIRS incident is people entering other people's bedroom spaces.
Yeah.
Some simple ways to support that is to offset bedroom doors down corridors, so that as you exit one door, you're not walking straight into another bedroom. You're actually orientating down a corridor. And so the other bedroom doors offset. So it's not a trigger to enter into it. There's little things we can do that can make a difference.
Yeah, and I think that's exactly right. And beyond the architectural thing about offsetting the doors, there's also, back to our earlier comments about wayfinding, simple things that we can do that identify a space from the outside as being a personal space belonging to someone else. One of the best examples I saw was a handmade poster that lived on the door of every resident's room in a particular facility. That poster consisted of pictures that told you things about that person. It not only helped them orientate themselves so that they knew this was their space, but it also was an amazing cheat sheet for learning an awful lot about the resident of that room. It gave you conversation starters. One gentleman in particular, I remember his picture had his name, it had a coffee pot, it had a football jersey, it had a set of garden plants, and you stood in front of that door and in 60 seconds you knew that Jim had a favourite football team, loved his coffee in the morning and was a great gardener. Those were all starting places for getting to know him, but it also marked the boundary of his space. So you knew to stop and knock and ask for permission to enter his space. So I think there's a lot more we can do in residential communities to make sure that we're honouring that sense of privacy. But I wanted to just move on quickly, Nick, to talk about getting outdoors and how important that is
So
for people in residential care.
For most of us, time outdoors is just a fundamental part of life. On a completely sort of pragmatic level, it affects our health and well-being. It affects how we feel and how we function. In residential communities, it's how we get how we're active and stay fitter, and the effect of sunlight on bone density, on circadian rhythms is well documented. In mind, again, I have one particular experience of one family member who I visited I used to spend a bit of time with in a residential community, who moved from a suburban house where he spent all his time outdoors to a building where he was anxious about stepping over a small bump going out to a balcony, and was on an upper level, and basically from that moment very, very rarely, if at all, got outdoors. And I think that's just really, really tragic. So people moving into care, into residential communities with the burden of a mixture of physical, cognitive and sensory impairments. And for me, the starting point is the environment's either helping compensate and get them outdoors, or it's actually creating barriers and turning what are impairments into things that are completely disabling. So when I go to a care home, I'm looking for, are the gardens just attractive, or are they places that people are accessing, are going to, and are doing stuff? And when I'm looking at what the building can do, I'm looking at how does, I'll ask Gwenda about this in a second, but again, it's the different meanings outdoor has for different people. So the images you've got here are somebody's gardening on one side, and this image from a residential community of people with some funny looking chickens over on the other side, which are meaningful to the people here. So I guess the first step is, how's the building giving people or inviting people to a range of different activities? How's it making it easy for people to get outdoors? How's it making it easy for people to see somewhere to go and something to do outdoors? And on a really basic level, making sure the doors are unlocked. Gwenda, this is something I know you're passionate about. What are your thoughts?
I believe that every room should have a door directly into a safe space outside. Now, that's not just a garden, particularly for Aboriginal and Torres Strait Islander people. We need to be able to get our feet in the earth. We need to be able to get our feet in Mother Earth. We need to be able to touch. And, you know, that's a bit of a risk. What if there's something there and we get a cut from it? Well, it's dignity of risk, dignity of choice. I also am rather passionate about fire pits. Many of us have spent our lives around fire. I know it's a real safety issue, and it's how do you balance that with the social and emotional needs of the residents. We need community spaces outdoor, but we also need private spaces. We need private spaces to sit outside with our families. We need spaces to be alone. And often your choice of trees can be so simple yet so significant for residents who are living where you are. And another thing that really gets me about being outside is hedges. I think hedges are every provider's best friend. You can hide fences in them so people aren't exit seeking because there's a hedge there. And I think that use of hedges is really, really an excellent way to do things. I truly think culturally we need to look at the social, the cultural, the faith, and then beliefs versus values. Do I believe that that particular bit of vegetation is going to do something wrong to me, or do I value it? And is it going to heal me? I mean, as those who know me know that celery in the bath that's just popped up is the way to go. You've got to have the celery. So therefore, I've got to be growing celery. How else am I going to get fresh leaves to put in the bath? Oh, but hang on, can I have a bath in residential care? That's a good question, isn't it? Because a facility that I was going to would have to have some sort of bath facilities.
Okay. And that's a very interesting lead into what we need to be doing with bathrooms and access to bathroom space. So Marie, you know, residential communities, the spaces are different. It's not going to be a home bathroom, but what can we do better?
And again, it comes back to personalisation. We want to make sure that things look and feel familiar. There's real push these days to some pretty fancy toilets in the homes that you might go and take a sticky beak on the weekend that are selling. They're not going to be familiar necessarily to the generation that are living in residential communities today or even tomorrow. So we want to make sure that the system looks like a system. If it's embedded into the wall, people may not realise that there's a button there to push. Good contrast between the pan and the toilet seat, because an all-white toilet with an all-white bathroom is a recipe for disaster. We hear a lot of times, you know, people are voiding in inappropriate places. I would say they're totally appropriate. If you can't find the toilet, well, then everything becomes a bathroom. So we want to make sure that we're creating spaces that are easily identifiable when people are having changes to their vision as they age, and then as they're perhaps developing cognitive changes and dementia. You know, the familiarity is really important, and even bringing towels of a particular colour. I know I have a range of towels, but they all sort of sit within a suite of 2 shades, and they always have. And I feel like that's easily recognisable to me. The pink and blue bathroom, you know, that's the retro bathroom. That feels to me like home. It feels like my family home growing up. It's very familiar. Like Gwenda, I have to have a bathtub. When I look at bathtubs in aged care settings, I get a little bit nervous. There's a big hoist over the top of them. It doesn't feel private. It doesn't feel personal. And I know, Gwenda, you had a comment around the use of wheelchairs in bathrooms and how people feel when they enter that space.
Because I don't want you undressing me in the bedroom next to my bed and wheeling me on a commode chair into the bathroom, and anybody else can walk in and out. You know, as we've said, bedrooms aren't necessarily safe spaces. And I think we've got to make sure we've got room for 2 wheelchairs, for the commode shower chair and for the wheelchair, so that I can be wheeled in and then transfer and I get undressed in the bathroom.
Yeah, and preserve your privacy while you're doing it.
and
Yeah.
dignity. And
Yeah.
a lot of people feel very unsafe. Again, you come back to your cultural and religious safety. A lot of people feel very unsafe being fully exposed, wheeled around a bedroom, and anybody can open the door and walk in on us.
Yeah.
You know, we've got to consider that.
Thank you. Nick, I'm conscious of time, and I'm wanting to make sure that you have plenty of time to tell us a lot more about the design principles and guidelines. But before we get to that, I'm wondering if I can ask you and Marie to talk a little bit about the role that the environment plays when we're actually catching up with friends and family. What it means in a residential community to be able to have small areas, what do we need to think about when we're setting up areas for social interaction as well as quiet spaces? How do we make residential communities homes?
Okay, and so I know that time is short, so I'm going to briefly touch upon this. And we've already said in many different ways that meaningful activity is different for everybody. It's different for us now, it's different for the future us, it's different for everyone. And so I think it's for me a lot about not prescribing that everybody must play bingo together or everybody must do this, but that offering of a whole range of different spaces where people can choose and be invited to a range of different activities. And I keep looking at that idea of is a space set up to invite people to do things. And the counterpoint to that is that we know that when people are dealing with various challenges that we're talking about in terms of cognitive and sensory challenges, the idea is to reduce the load of noise, to reduce busyness, to reduce clutter, to make space where somebody's not distracted away from a small conversation. They're not distracted away from what they want to do. And so that's that whole beauty of anything which is smaller scale means there's less likely to be noise, there's less likely to be distraction, and somebody can focus on what matters to them, whether it's looking through a photo album like the image on the left or having a small chat like the image on the right. Marie, what are your thoughts?
Absolutely. I think my next photo talks very much about what you're referencing, Nick, that the importance of small spaces. And at home, we might all have our favourite chair that we like to sit in and our favourite spot on the lounge. My background behind me at the moment is of one of our cottages in Hammond Care, and the furnishings and fittings in residential communities have changed so much. We really need to lean into that. We really need to look at comfortable settings for people. They need to be able to get in and out of chairs. That's really important. But it's come a long way. And so it feels like something I would have in my own home. And so I can walk into one of these cottages, take my shoes off, curl up on the lounge and have a chat to someone who lives there and feel like I'm at home. And that's really important.
And to be able to share that space when we choose to, as well. I think we all know the value and importance of social interaction as we age, and so we need for our environments to be able to be encouraging that as well. Nick, could you actually talk us through, please, the National Aged Care Design Principles and Guidelines, because they really are the core of, I think, what we're all aspiring to see in residential communities in Australia.
So I'll touch upon things very briefly here because in the next webinar we'll go into more detail and then further in the 6 that follow. The basic premise here is staff do an amazing job, and either they've got an environment, a physical environment which is helping them, or it's getting in the way. And everything that we've mentioned in today's discussion, right, is basically touching upon these issues. We set up the book to have 4 principles. They're on the screen at the moment about enabling somebody to function more effectively. We talk about cultivating home, what it means for different people getting outdoors, accessing the environment, and finally, how people stay connected with community, or in the example Gwenda gave, that she's actively looking for a place where she's going to feel part of a community. The principles and guidelines allow a variety of design approaches and responses to meet different circumstances of different residential aged care communities. And so the application of the principles should be a collaboration between residential aged care communities and the families, or the people living there and their families. And so each of the webinar series as we go forward is going to unpack these principles in more detail and go into some of the guidelines.
Fantastic. Thanks, Nick. And I'm really looking forward to the rest of the series and diving deeper into some of the principles and guidelines. But thank you, everyone, for participating in our conversation this afternoon. Today's session is the very beginning of the Home Matters webinar series. You're going to find a number of really great resources that you can access on the Dementia Training Australian website, including information about the design principles and guidelines and the care home assessment tool, which will help give you a snapshot of where your home might be at and what sorts of things you might want to do in the future to make changes. There's also a lot more information on the remaining webinars in the series. So we're going to start the Q&A portion of this afternoon's presentation now. So if you haven't already, please post your questions. The panel are here to make comment and answer if we can.
Izzy, would you like us to pick a question? Because I can see a perfect one.
Oh, yes, please.
There's a question here. How should other wandering residents be managed when they persist in going into other residents' rooms? Okay, I'm going to do a little bit of language here first. So, and I love that you put the quote marks on wandering, because it is about actually someone walking. They're going somewhere. So when we talk wandering, people are walking, they're seeking something. So they're actually looking for something. And it is a big issue, as I said, in aged care settings. It happens a lot, and it is where incidents do occur, because no one wants to have a stranger lob into their bedroom in their private space. So that really good wayfinding, as Izzy was saying, with the doors or memory boxes as well. And sometimes, you know, it is actually acceptable to have doors closed to bedrooms. And some residents really appreciate that as well. But I think it's asking the question, what is that person looking for? What are they seeking? Some people are, I call them bowerbirds. They're looking to collect little objects as they move around a care home. Let's give them objects in other places of the care home that they can collect and gather. That gives them a sense of purpose and identity. But what are they seeking? That is the question we need to be answering when people are entering other people's spaces.
Yeah. I'm going to pick another question there, which is one that's, I think, also just allows me to just talk a little bit about the resources available. There's a question about light and light fittings, and there's a wonderful book here that I'm just going to now hit post on, so it'll go up onto the chat, which goes through considerations with lighting. And the reason I just wanted to mention that is, as an architect working in this area, one of the actual great things for me is there is 30 or 40 years of research that my work is based on. It's not like other areas I've worked in where architecture is about what somebody likes or a style choice. We can actually lean back on a whole lot of research. So this book goes through what lighting levels there should be in different situations. It talks about glare and other considerations. So for any designer who's working on light, it's fundamental, and there are resources like this that are available so that we get it right.
As Genevieve said at the beginning of our session, we're going to be publishing answers to the questions after this session. Unfortunately, we're not going to have time to answer all of the questions that have been posted this afternoon, but there was one specifically for Gwenda that I wanted to call out. Gwenda, always a joy hearing from you over time. I'm keen to hear what physical and social structures supported you in the first weeks of the move.
The social structure, I think, was knowing that the CEO and the manager who'd actually signed me up were always available for me. Okay. I mean, I text or they were there. I think that was it. And then I was actually introduced to a woman who, interestingly, had identical glasses. And
well, there you go.
And she is now my best friend at Moreover. She is really, I see her every day. I make sure I go and see her every day. But we had a connection. Obviously, somebody thought I liked colour. I was introduced to other colourful people. I think it's about making the connections like with like. But then, I don't know if I mentioned it before about dementiaism. In residential care, we've got people with some cognitive decline who don't think it's worth speaking to some people living with dementia. And we have a coffee shop, and one particular woman advancing in her dementia adventure loves to go and make the cups of coffee, and she steals the newspapers. She takes the newspapers back to her room. But I shouldn't be wasting my time talking to her. Other people don't want me wasting my time talking to her. And it's really interesting because I really like her. And so the dementiaism, I see it coming out in many different ways from residents. I don't see it coming as a stigma from staff, but how do we break that down in the community? That's another goal, to say it's okay for people to be at different stages of dementias in residential care.
Yeah, the inclusiveness of the environment is actually really important. There've been a couple of questions in the feed around how do we change the attitude of staff and sometimes of residents when they're trying to do things a bit differently and move away from sort of older patterns of behaviour. Both Dementia Support Australia and Dementia Training Australia do a huge amount of training with staff in residential communities to shift the dial on the way in which we approach providing care and support. And you can find those resources and links through to the Dementia Support material, Dementia Support Australia material as well on the DTA website. So that will be a really great place to start. We're just about at time, folks. So I'll conclude our Q&A session now. Thank you again to everyone who's joined us. There is a survey and we'd really like it if people could help us improve our webinars. The link to the survey is going to be pinned at the top of the Q&A function, and we'll send you a post-webinar email so that you could do it from there as well. It's only going to take you 1 or 2 minutes, but it will make sure that in the rest of this series, we are actually covering the topics that are important to you. Thank you, everyone, for your passion. As well as your insights. It's, I think, the beginning of a really important journey to improve residential communities across Australia. And I'm very glad that you've all been able to join and listen in today. Please join us for the next one. Thank you.
Thank you.